Here's where the New York Times saw that same article, and their title was, "Surgery for Blocked Arteries is Often Unwarranted, Researchers Find." Drug therapy alone may save lives. And what they left out, obviously, was the most important thing. The most important thing is not drug therapy. The most important thing is lifestyle changes. So this was a large international study led by Stanford and New York University. So again, both well-respected universities in this space. They found that invasive procedures are no better than medications and lifestyle advice in severe stable heart disease. Patients with angina did benefit from invasive procedures in this study. As we've seen in other studies, like the Orbita trial, they didn't. Whenever I start talking about these stents, people will say, well, you're not telling the truth because I know that it helped my angina. We'll get to that. I'm sure somebody will want to make that comment later on. The Ischemia Trial was designed to reflect current clinical practice in which patients with severe blockages in their arteries often undergo an angiogram and a bypass with stent or bypass surgery. Now, these results don't suggest patients should undergo procedures in order to prevent cardiac events, according to the authors. And I know we've already started getting some comments that are saying, my doctor's recommending a stent. What should I do? I'm reporting the news, and I'll talk about the advice that I usually give. Until now, there has been little scientific evidence to support whether intervention is more effective in preventing adverse heart events, more effective than simply treating with lifestyle and medications. And so why have we been doing so many stents and so many bypasses? Well, we thought it was the right thing to do, didn't we? We made an assumption, and when we actually start looking, that assumption turns out to be wrong. Again, I get back to that analogy of eating cholesterol in your diet. You see cholesterol in your arteries with plaque, and you say, well, if it was cholesterol, then cholesterol in our diet must be causing this. And then you get Ansel Keys in the 7 countries study, and obviously not enough countries for those of you who know what I'm talking about. We make these assumptions, they impact the lives of tens, hundreds of millions of people. And then we actually decide to start digging into and when we find the truth, it's sometimes not what we expected. Those who underwent an invasive procedure had roughly a 2% higher rate of heart events within the first year compared with those on medical therapy alone. And that was attributed to procedure risk. So in other words, not only did it not help long-term, you also did have some procedural risks.